Hi, Jeff. Welcome to the Animal Tone podcast.
Hi, thanks for having me.
I sat yesterday trying to watch a couple of videos about bioethics and trying to just give myself a bit of a crash course in bioethics. And one of the things I came across was some of the principles that are apparently like the grounding principles of bioethics. And maybe you can tell me if this is correct. One was the idea, and I think that this is rooted in that first segment that you were talking about with regards to health, not necessarily the environment, was the idea of autonomy, that as an individual, you have autonomy over your body and yourself. I'm going to say these words wrong, beneficence, that doctors should want to do good, or health establishments should want to do good, and then non-maleficence. Did I say
hmm
it right?
Yes, you did. Yeah.
I practiced it so many times. Non-maleficence. So don't avoid doing harm, and
Yeah.
then justice. And I
Right.
found these really, I mean, these are obviously all massive concepts, but I found them really tantalizing for thinking about bioethics. Because like you said, or like we were talking about earlier, we have a tendency to only talk about bioethics when it comes to humans. Maybe you could tell us a little bit more about these elements, and do you use them in your work and your thinking about bioethics?
Yeah. Great question. Yeah. So setting aside the kind of public global health and environmental questions for a moment and focusing mostly on these medical and research ethics questions. Yes, those are absolutely commonly used principles when it comes to interaction with humans in medical and research settings. When it comes to interaction with humans in medical and research settings, then we deploy these principles and we might understand them more simply in terms of respect and compassion and justice, right? Autonomy means respecting the choices that people make about how to lead their own lives. And compassion means trying to help others where possible, or at least not harm them unnecessarily, right? And then justice requires things like making sure you distribute the benefits and burdens of research equitably instead of, for example, disproportionately disadvantaging vulnerable populations in order to generate benefits that you then disproportionately give to privileged populations, right? So we think in terms of respect and compassion and justice in those senses. And there are a lot of difficult questions about how to balance them and what they mean in particular cases. But it helps and it matters that we aspire to do all three of those things in our interactions with human subjects, to treat them with respect, respect their autonomy, to treat them with compassion, try to help them or at least not harm them, and then to treat them with justice, distribute benefits and burdens equitably, avoid disadvantaging vulnerable populations. And then with animals, almost all of that goes out the window. And when we interact with non-human animals in medical and research settings, really at most we focus on a weak version of the compassion principle, beneficence and non-maleficence. We get rid of respect, and we get rid of justice. Those considerations really don't even enter the story, and instead we focus on what are often described as the three R's, which is replacing the use of animals when doing that is scientifically feasible. And then if we must use animals, refining our use of those animals and reducing our use of those animals. So in general, trying to avoid using animals unless we have to. And then when we do have to use them, trying to use as few of them as possible and harm them as little as possible. And that is better than nothing. But we don't do anything like the respect principle where we respect their autonomy, and we don't do anything like the justice principle where we make sure that benefits and burdens are being distributed equally to human and non-human populations. And even when we care about harming animals, we treat the science as more important than animal welfare. In the human case, we understand, we intuitively, implicitly understand that we simply are not allowed to perform harmful, lethal, uh, non-consensual, non-therapeutic research on vulnerable non-human subjects in order to benefit humans. Sorry,
Mm,
sorry.
the
Let me
other
say
way.
that. Let me say that part again. In the human case, we naturally understand that we are not morally permitted to perform invasive, harmful, lethal, non-consensual, non-therapeutic research on vulnerable human subjects in order to benefit other humans. Even if that is the only way to create that benefit, we know that that way of treating vulnerable human subjects is still wrong, and so we simply should not do that. But in the non-human case, we forget that kind of idea, and we think that if we can get any kind of benefit at all by harming or killing non-humans in these ways, then the knowledge that we might gain or the medical advances that we might gain justify that treatment of them, which I think is a double standard that needs to change.